Meet Cinzia Miksitz, who has had to live with pain in both of her hands.
I feel numbness in my fingers and thumb, mostly weakness and pain in my thumb muscle, and it got to the point where everyday things were bothering me. Vacuuming, curling my hair, washing dishes, having to grip things that are wet and slippery. It's mostly my right hand because I'm right-handed, but on my left hand I have some issues also. But on a daily basis, regular things bother me.
Enter Dr. Joseph Failla of the Detroit Medical Center, who quickly identified her problem, Carpal Tunnel Syndrome.
Carpal Tunnel Syndrome is a feeling of tingling, numbness, and pain, most commonly in the thumb, the index, the middle finger, and just the thumb side of the ring finger, due to pressure of the nerve in the carpal tunnel. It's called the median nerve, and that nerve gives sensation to these four fingers and also gives motor power to this large group of muscles here.
The carpal tunnel is the route through which the median nerve goes from the forearm into the hand.
And in that tunnel with the nerve is all the tendons that go to the fingers. There's 2 for each finger and 1 for the thumb. So there are 9 tendons in that tunnel with the nerve. It's very crowded in there. And as time goes on, that tunnel narrows and the lining of the tendons thicken. That's just part of a degenerative process of getting older, and that causes the nerve to be compressed.
Dr. Failla described how the median nerve branches into this large group of muscles. These are called the thenar muscles, and they have a very important function called opposition.
That's where you take the thumb and you face it against one of the other fingers. So that's a very important function. The ability to do that allows you to, let's say, button buttons or zip zippers, or to open jars, or to do very fine motor activities. Without that, imagine what happens, Emery, is if you try to bring your thumb like this but you can't do it, your thumb will collapse. And if it collapses into this position where you can't rotate it over, your thumb will fall down against the palm and you won't be able to do the fine motor activities of what's called opposition. So what happens in carpal tunnel syndrome, if it goes on too long, is the nerve that goes over to those muscles, it's called the motor branch of the median nerve, that nerve supply will not be present in the muscles. The muscle actually atrophies, and then you get a big concavity in the muscle here because the muscle is gone and the patient can't rotate their thumb over or bring it away from the palm. So it's very dysfunctional.
So not only can there be tingling, numbness, and pain, as in the case of Cinzia Miksitz, but carpal tunnel syndrome can also lead to serious functional problems. So what can be done?
Once you've decided, okay, I have a patient with carpal tunnel, and if it's moderate or mild, you can treat them with a splint. You can control the symptoms for some time, especially if people can't take time off their work, and with bad economy, that's a big consideration now. People who have, they're suffering with this tingling and pain, they don't want to take time off work because they're worried about being out and losing their job. So there are things you can do. You can put them in a splint, you can do a carpal tunnel injection of steroid to lessen the symptoms. But when people fail all that treatment and they're getting worse and worse, then surgery will help. And what you do is you basically open the tunnel. There's a ligament that goes across from this side of the wrist to that side of the wrist. It's called the transverse carpal ligament, and it's pressing right down on the nerve. So you can make an incision in that ligament, and the ligament will pop open and take the pressure off the nerve. So you can see that the distance between the 2 edges of the cut ligament in this patient, it's spread a fair amount. I mean, it's more than ½ a centimeter. So that widens the tunnel. And now the nerve is covered by this ligament, so it's protected still, but it's not pressed by the ligament.
Any initial pain and recovery is controlled with medication, and rehabilitation is all important.
This is a week and a half, maybe 2 weeks of pain, and then you recover and you have your hands and your strength back. It's worth it to get it done.
Okay.
Yeah. The fingers feel much better.
The tingling, is that gone?
Yes.
Good. Completely? Congratulations.
Thank you. Especially this one too, because this was the worst.
Very good.
But yeah.
To learn more about carpal tunnel syndrome or to schedule an appointment with Dr. Joseph Failla, log on to dmc.org or call 888-DMC-2500. I'm Emery King.